Heparin and LMWH are administered in which forms? So, heparin is administered subcutaneously and it is administered intravenously. And LMWH is administered subcutaneously. Then, when heparin is administered subcutaneously, it shows the anticoagulant effect within 1 to 2 hours. It shows the anticoagulant effect within 1 to 2 hours. When heparin is administered intravenously, it will show the effect within minutes. Okay, within the minutes you will see the heparin effect if it is given intravenously, and subcutaneously within 1 to 2 hours. And when low molecular weight heparin, that is LMWH, is given, it will show the anticoagulant effect within 4 hours of administration. Then we will learn about the half-life of heparin, and we will learn about the half-life of LMWH. For heparin, the half-life is 1.5 hours, and for LMWH, the half-life is within 3 to 12 hours. When LMWH is given in renal impaired patients, then obese patients, and pregnant patients. If it is given in these three patients, there is a need to monitor the factor 10 level. Factor 10 level monitoring is recommended. Factor 10 level monitoring is recommended. Always remember, guys, when you give the low molecular weight heparin into the renally impaired patients, the half-life of LMWH will prolong. Okay, it is going to prolong. So, therefore, low dose of LMWH is given. In which patients? In renal impaired patients. Okay, in renal impaired patients, low dose of LMWH is given because the half-life is getting prolonged. After that, we will see the side adverse effects. The adverse effects of heparin and LMWH is bleeding. Bleeding is a major side effect. So, if the side effect or adverse effect is bleeding, monitoring is required. We should always monitor a patient who is on the anticoagulant for bleeding. If there is excessive bleeding, we have to stop the drug. Excessive bleeding, what will be the step? Discontinue the drug. And you have to treat with protamine sulfate. Okay, treat with protamine sulfate, that is 1 mg for every 100 units of heparin. 1 mg per every 100 units of heparin is administered. So we have to titrate carefully. So titrate protamine sulfate carefully, because 1 mg for every 100 units of heparin is administered. What? That is protamine sulfate. After that, the other side effect is HIT. What is HIT? HIT is heparin induced thrombocytopenia. What it is? Heparin induced thrombocytopenia. What happens in this? Number of platelets, they become low. Number of platelets become low. Therefore, there is a risk of venous arterial embolism. When number of platelets become less, there is a chances the patient may develop heparin-induced thrombocytopenia. If the patient is on heparin, then only heparin-induced thrombocytopenia can happen. So, in that case, the patient is at a risk of developing venous arterial embolism. So, in that case, we have to discontinue the heparin. Okay, so what we will do if patient develops it, discontinue heparin. Discontinue heparin. And we are going to replace heparin. Discontinue heparin and replace heparin with ergatroban. Ergatroban. Okay. So this is a patient. Patient develops HIT. Okay. Heparin induced thrombocytopenia. So what we will do? Discontinue the heparin and we will give him ergatroban. Then after that, the other adverse effect is osteoporosis. If patient is on heparin, there is a chances of developing osteoporosis. So it is developed when patient is on long-term heparin therapy. If patient is on long-term heparin therapy, there is a chances of developing osteoporosis. Now we will see contraindications. Okay. So heparin and LMWH are contraindicated. In which cases? So heparin and LMWH are contraindicated in patients who are having hypersensitivity to heparin. If a patient is hypersensitive to heparin, then heparin is not given. It is contraindicated. Avoid giving heparin. If patient is having bleeding disorders, in that case heparin is contraindicated. Don't give. Alcoholism. Okay, in this case also contraindicated heparin. Patient has underwent a recent surgery. Surgery of what? Patient has underwent a surgery of eye, brain, spinal cord, or any other surgery. Then heparin is contraindicated. So heparin is contraindicated in patients who are hypersensitive to heparin. Patient is having bleeding disorders, alcoholism, and patient has underwent recent surgery in eye, brain, and spinal cord.